Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, it's time for our regular monthly healthcare update. One of our experts is here to provide us with his insights into some important healthcare matters. And then, what's going on in the state capitol? Well, we got a couple of the state's leading reporters to weigh in on some of the big issues, particularly liquor privatization. Where is that all going? We'll be back with that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me as often is the case is one of the experts we call in from time to time to help us understand the complexity of healthcare is Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. I think I got that right. Complexity, right? You live in a very complex world. I don't know how you understand and follow it. It's really very complicated, isn't it, Doctor?
It is very complicated. And one of the nice things about coming on here is I can talk with you about facts.
Yeah, well, that's important.
I'm not a Republican. I'm not a Democrat.
That's exactly
I'm like
right.
an umpire who calls balls and strikes as I see them. Yeah. And that's what I'll do today.
I want to talk about the budget for, in the state healthcare budget, and a little bit about Medicaid expansion still up in the air. But before I get into that, I think this is pretty important. We are buffeted now with a series of stories about the implementation of the Affordable Care Act. Where do you think that stands in 2 or 3 minutes, and then we'll get on to the other? It's an important subject, I think, for our viewers.
Great. The governor is facing a lot of pressure to say, I want to expand under Medicaid. Right. But let's look at the facts. Today, Pennsylvania spends more than 48% of 48 other states on Medicaid as a percentage of their state budget. The governor has asked the federal government 4 simple questions. And again, I'm not for it or against it. I'm for looking at the facts. He said, how much will you pay federal government if we expand it? He said, for how long will you pay that? He has said, under what conditions will you pay that? And then he has said, what flexibility will you give us? He hasn't gotten answers to those questions. So he is a little bit like Sidney Crosby as he plays in the Ottawa Penguins series. He doesn't rush to where the puck is today.
Right.
He's looking ahead 2 years, 3 years, 4 years of where the puck's going to be or where the financial state of the state's going to be. And he is being very clear. Answer some questions, and then we can have a dialogue. Yeah. But he's not reacting emotionally. If he were to expand Medicaid today, the implications are that 1 in 4 Pennsylvanians will be on Medicaid for their health care. And he's asking, is that sustainable? Mm-hmm. Now, he's putting all the emotion aside. He's saying, what can we afford? Where this is going to end up, I don't know, but I don't think we ought to rush to a judgment that he's anything but thoughtful.
Yeah, I mean, one of the other things that sort of puzzles me, and like I'm a neutral in this, I have great healthcare coverage. I won't be affected by this, but we obviously care about patients and care. Here's another question for you. Can we afford the Affordable Care Act given these circumstances? I've always wondered if the young folks who are supposed to buy coverage or pay a penalty and pay for the rest of the folks, particularly older folks who are sick who will get provided, is that a sustainable model, knowing the young immortals are not likely to buy coverage or pay the fine some way, somehow?
Well,
do you think that's a sustainable model?
I'm not sure the model is sustainable, but I do know that if Medicaid is expanded and it is not financially sound, and I'm not sure it can be, that services to the elderly and the disabled who need real services today, there's going to be wait lists. Because the pot is only so big here in the state.
Right.
We can't print money like the federal government can. We can't run a deficit like the federal government. And if, without real assurances and dollars from the federal government, Medicaid is expanded under the Affordable Care Act, it will take dollars from the frail elderly, from the disabled, and from kids. So that's why this analysis needs to be looked at very carefully and not emotionally. And that, I think, is what the governor's trying to say to people who are saying, move on quickly. He's saying let's approach this thoughtfully.
Yeah. Okay. We're going to run to a break. When I come back, let's talk a little bit more about the healthcare budget in the state. It's consuming more and more. What's 24%? I heard figures like 27% of the state budget. Does that sound about right to you? Something in about a quarter of the state budget goes to all sorts of healthcare and medical services. Does that sound about right to you?
Let's get to that after the break.
He says we're going to get to it after the break. We'll do that.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking with Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. He's one of our go-to guys on all things related to healthcare budgets. I will say this. I noticed that healthcare costs only went up in general 3%, 3.5%. There's not rising these about twice that over the years. I don't know in your nursing homes whether that's true or not. But overall, it looks like the impact of healthcare, I don't know what that'll have to do with the budgets, whether that makes them more sustainable or not. That's something that's why I'm asking you.
Well, let's look at the state budget. Do we have to, the legislature has to pass the budget over the next 45 days, more or less. And there's a lot of challenges. And as you know, I like to talk about the elderly and the disabled.
Right.
And most of your viewers have a simple concern, which actually was told to me by a Swatera cop the other day. He said, I don't understand all the budgets. He says, my mother's on Medicaid, but the real question is if she falls and breaks her hip, which a friend of another cop's father did, where's she going to get the care after the hip is repaired? And is she going to be able to find a nursing home where she's going to need to go, where she can get care near her house that's of good quality? And it's interesting, the state budget addresses that question. And for the first time in several years, a governor in his proposed budget said, let's put a little bit more priority onto the frail elderly. And the governor did that by putting in a small budget increase. And he said, that's a priority. And that, in fact, is something that I hope the legislature continues. Now, there's all sorts of debates of, well, where dollars should go. Should it go towards transportation? Should it go towards horses? Yeah. Should it go towards education? And the legislature is also looking at some other things. They're looking at should the frail elderly be able to find access to a nursing home that's close to home? And should they have to stay in a hospital longer than is necessary before they go to a nursing home? So it's the elderly who I tend to work with, and as I call balls and strikes, is a real priority this year. And I'm hopeful that despite what the money that's spent on Medicaid, and you said earlier how much is spent, Pennsylvania spends close to 35% of the state budget,
total state
budget on a variety of Medicaid programs. Many of those, by the way, not mandated by the federal government, which is part of the problem under Obamacare, is that our benefits are real great today, and the governor has said, can I cut some of them back? But the frail elderly needs to remain a priority. Governor has wanted to do that, and the real question is, will the legislature support that?
Yeah. Go ahead. On a related topic, I've been into a lot of nursing homes in the last couple of months doing talks. They have, and one of the things that really impresses me, and we're off the subject, but I'm the host, I'm allowed to do this, is every time I go in there, I would think, oh, this is a little scary for people. They come out of their homes, they go, these people love it. I mean, by and large, every place I go, I talked to them about it. They really enjoy it. They're a little fearful, I think, oh, I'm leaving my home. I got to go into a nursing home. I'm amazed at how many people get in there, and they really enjoy the camaraderie. They enjoy the, getting together with their peers. It's amazing.
It's a new home with care being provided that's very secure. The food is pretty good. But
and healthy.
Most of all, the health care is really good. No one goes into a nursing home if they don't need 24/7 care. And it's really important that we continue to make them a priority in this state. And that's why I get up every morning. That's why I come to work every day, is to make sure those folks get their care.
And we have, as we've talked about before, I mean, look at 75 million of us who, baby boomers, are reaching that stage. In some cases, you can stay in your home. In some cases, you can't. Why that part of what we do, and particularly in Pennsylvania, is so important. Third largest senior citizen population in the country, and why the health of nursing homes is I think, a pretty important area of state government to be concerned about. You get the last word.
It's a pleasure being here, and let's remember George Leader, who just died, former governor.
As we tape this, as it airs around the state, George Leader's funeral will have been on a Thursday. Go ahead.
And he was governor very young.
Yep.
He's been over 50 years since he was governor. Yep. And all those 50 years, he devoted himself to the elderly.
Yep, that's true.
To building programs. And so let's mourn him well.
He gets the final word. All right, we have a duo of the state's leading reporters. We're going to talk a little bit about access to information, right to know. I don't know if we'll talk to the Associated Press about that right now, but we're going to talk about that with two of the state's leading reporters after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Joining me is Amy Worden with the Philadelphia Inquirer and Mary Wilson with Pennsylvania Public Radio. These are journalists who are on top of the big stories in Harrisburg. Mary, I want to start to you. We have a 5-year-old law. It's known as we call it Right to Know. It's really an open records law, I guess. There have been some amendments introduced, largely, I think, based on the number of requests that small governments are getting for all sorts of information. Give us an outline of the basics of the amendments that are proposed to this 5-year-old law.
Yeah, tons of amendments. Let me give you highlights instead of trying to overview, clump them into one category. The one that the executive director of the Office of Open Records calls the most critical is one that's meant to kind of ease the burden, like you said, on local governments that are being swamped with record requests. The way to do that is one of the problems here is they're getting record requests from commercial users, people who are trying to take advantage of the fact that there's somebody who will cull through these records for them and hand them over.
And they're getting them for free.
And they're getting them for free. I mean,
they
you'll have copying requests.
Copy request, yeah.
Right, you'll have copying costs when you file a request like this, but now what's been proposed is a fee structure based on like someone's hourly wage to make someone who's a commercial entity making this request pay upfront for making a request like this.
I mean, Amy, you've covered a lot of these big stories where, as a reporter, you've had to try to get information that you had trouble getting. That's a little bit different. And I'm not saying that the public shouldn't have access. We think they should. But as Mary points out, in this case, you have some businesses, the examples used where, well, somebody may open you have to get a request to put a swimming pool, build a swimming pool, and then a company will come in that wants to sell swimming pool liners. so they can use it for business purposes, and that's in another category than, let's say, public interest in stuff going on. Go ahead.
Right. Well, I think one of the other major issues with the way the bill is being rewritten is some wording unduly burdensome, and how that's interpreted by municipalities and other government entities subject to the law, because. Right now, as Terry Madonna, the director, has said, she's seeing cases where people are asking for routine information that should be easily available and is absolutely public, like salaries of elected officials, for instance, things like that shouldn't be a problem, and people are coming to her, complaining, or they're sending these requests back and saying that, it takes too much time. So she's really concerned about, and others concerned about that wording, giving way too much leeway for local governments that are already reluctant, in many cases, to provide that information. More reason not to provide it.
So we have sort of two big problems. We have requests that are coming from the business community, as you point out, and then
prisoners,
prisoners,
another
right?
big issue.
Mm-hmm. Yeah, is there language in there I read where in one of these amendments that wouldn't allow the office to publicly comment?
Right.
What's that about?
There's language, and she also objects to that. There's language to prevent the office from publicly commenting on records requests that are pending, or proceedings that are pending. So, if these things are being appealed, if an agency denies a request, if it's being appealed, the office has played the role of kind of like public explainer, kind of saying, well, the appeals process is in this stage, and this happens. The requester's premise here is that these records should be public. The agency says this, a way to explain what's going on. That's Terry Madonna's point. You talked to the spokesman for Dominic Pileggi, Senator Majority Leader, who drafted these proposals. The spokesman there says, well, this is a quasi-judicial agency. It's pretty common to require a judicial body to not comment on something that's still in the works. This is standard.
Right. The argument, though, from the Office of Open Records is, and from supporters of access to information, is that you're essentially, ironically, gagging the office that is supposed to be providing access to information.
That's an interesting angle. We're going to run to a break and talk about liquor privatization. We had some hearings this past week. Do either of you want to speculate where this goes? Are these amendments likely to pass the entire legislature, or is it too early to know?
Right here on Right to Know?
Yeah, right to know.
I think they're going to rework them. We just saw a hearing, and the director of this office voiced some concerns, something that had never happened with the drafter of the proposal. They had never had a chance to say, we've both read the proposals. So I think there's still some work that needs to be done.
All right, in a minute or so, after we pay some bills, we're going to find out liquor privatization. Where does all that stand? Is optimistic, pessimistic? We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
All right, we're back with Amy Worden and Mary Wilson. Okay, we have another debate last week on liquor privatization. We heard more criticism during the debate about privatization than moving forward. Give us some of the highlights of where you think this debate stands.
Yeah, well, one can only compare this to Homer. It's a little.
No, don't do that.
It's it really. I was thinking about this morning, and it reminds me of the Odyssey, a very long trip with a lot of obstacles. Oh my God. And the most recent being now not to say that Odysseus hasn't actually leapt some of these hurdles. Right. A bill to privatize the state system did in fact pass the state house. Now
complete privatization of the state-owned stores passed the House.
That was momentous. However, now it's gone into the great hole of the state Senate, and so we start the process again. We've had now several hearings on the bill. I think that the argument for many, many years about why this has not come to fruition is that there was never really an organized group fighting for privatization. Now, this time around, you kind of do. I mean, you do have the governor out front on it, and you do have some of the free market groups and Commonwealth Foundation, for instance, being very aggressive on this. Very aggressive. Buying ads. This is sort of like the politics of the off year. On the other hand, you still have some really organized opposition groups, particularly the
Labor,
union. But
Democrats.
But now you also have the addition of MAD. MAD has come into the equation.
Mothers Against Drunk Driving, they're now back on the scene. First time, I think, in the hearing last week that I've heard anything from them against it.
Right, saying this is going to increase teenage drinking.
All right, let's talk about some of the beer distributors, of which there are about 1,200 of them, seem to be all over the place on it. The hearing that you covered, I mean, some are for it, some are reluctant because of the competition. What groups, in addition, do you, or what considerations have prevented this from moving forward?
Well, they're trying to rework an entire system that has now, it's now not just about the state stores, as McElhenney said.
Good point.
It's, I mean, and it was like this the minute it came out of the House, right? It wasn't just about state stores, it became about beer as well, which already has a system. So trying to tinker with that is going to, you know,
that's a good point.
It's like pulling.
So your point is not only are they trying to deal with 600 state-owned liquor stores, which they want to privatize, but they've thrown beer in, and we already have a system, and everybody has an interest. Is that right? Am I getting this about right?
And what you saw at the most recent hearing, yes, to your point, and what you saw at the most recent hearing was a bunch of people who have a stake saying, oh, well, I would really like this. I would really like this. I would really like you to screw me a little bit less than you screw the guy down the street.
So everybody who's involved wants to make sure that, and you can, I mean, in all honesty, to their point, if I have a business and it's up and running and you're talking about changing the rules, I'm not saying it's right or that, you know, they don't have a right to do it, Amy, but think about, I mean, you're going to do what? I've been doing this for 50 years. Well, yeah, 50 years, and now you're saying, go ahead. I mean, you know, how much of a problem is that?
Yeah, well, no, I know. Now, you sort of open the flood, when you sort of change the parameters, then you open the floodgates to more interest groups raising their particular issues.
Now, Senator McElhenney, who chairs the Law and Justice Committee, he's the Republican chair of the committee, has been under a lot of criticism. We have less than a minute to go, Mary. He says this could not get done before the end of June when they take the summer recess and well into the fall. Is that correct?
That's what he said. He said, I'm doing my best, I'm looking for consensus, but at the end of this second hearing, we got one more, and then he'll start drafting a proposal. At the end of that hearing, he said, look, I didn't come up with this timeline. I didn't say I really want to tackle liquor privatization, alcohol reform. This was handed to me by the House and the governor and said, get it back to us by July. Well, you know, this is a brand new issue for our chamber.
And as we leave the Senate, there are a lot of senators who support what we call modernization, meaning just keep the system but make it work better. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.